I joined Ingalls about 3 years ago, and we were penalized quite heavily by CMS for our readmission rate. And we moved that up incrementally over the years. So last year was our biggest leap yet. We went from almost at the maximum penalty of 3%. It was at 2.94. The year after that, we were at 2.54. And then last year, we were at 1.52, which is a little over a percent, which equates millions of dollars. And so when I last sat with you, or last year, I had no idea that was going to come down the pike. And so now, looking back at it, we're right in the middle. It's still not perfect. And as a clinician, you always want to be approaching zero. But we also know all readmissions are not avoidable. So what do you do to kind of get you to the next level, right? And so we've been using MCG amongst other platforms to kind of really round up our offering to see how we can boost our platform moving forward. And we've seen it quite successfully with the penalty the way it was lowered. It's a journey. It doesn't take overnight. And I think the staff needed to see that the accomplishment is there and to get recognized for that. And at the same time, having the ACO be known as a well-performing ACO in the nation. I take that back as to say, well, how did we get there? And I think it's a lot of the, again, I always say foundational, because we look at MCG as that, as the foundation to help us get to the next level. And the two successes we've had, obviously with the CMS penalty being the way it was, lowered, and then now with the ACO continuing to have its successful run, all based off of being consistent with the usage of MCG guidelines.